Thank you, everyone. Good afternoon. Good afternoon. Great to be back here and to talk about a topic that is so critically important. First of all, I'd like to acknowledge some of our distinguished guests who are here. Commissioner Anne Marie Sullivan. Dr. Sullivan is the head of our Office of Mental Health, and she is at the forefront of finding solutions to help people, and particularly our young people, cope with everything that life is throwing at them. So Dr. Sullivan, thank you. Thank you for being a part of our team as well. Suzanne Miles-Gustav, I want to thank her for being the acting commissioner of OCFS, all you do for us as well. And thank you very much. Let's give her a round of applause. Suzanne. You'll be hearing from Dr. Michael Lindsay, who's the professor of social work here at NYU, but also is a leading expert on behavioral health, on child and adolescent psychology and social work, and making sure that, again, using science to help us find answers to our problems today. So Dr. Lindsay, thank you. We'll look forward to hearing from you in a couple of minutes. We also have Katrina Armstrong, the CEO of Columbia University Irving Medical Center. Let's thank our CEO for being here, Dr. Armstrong. Blair Simpson, the chair of the Department of Psychiatry here at Columbia University. Dr. Simpson, thank you. And someone that you're going to fall in love with, a young woman who has the courage to do what you will have the courage, but as soon as you get up here, you'll be fine. Kay Danielle Thompson, a student speaker, and all the students that I just had the most incredible experience sitting down with, having a chance to hear from them directly what the experience starting exactly 3 years ago was all about, how they cope with the pandemic, the isolation, the distance from their normal support systems, how they got through it, how they often help their own friends and help their own family members, and what the effects are still today, 3 years later. Because we're still reeling with the effects of that pandemic on society overall, but certainly our children who were trying to be regular teenagers in middle school and high school, which is hard enough as it is. And you throw a pandemic on top of it. So those who are the survivors of that will always look back and say, I can handle that because I got through the pandemic as a teenager. So I would wear that as a badge of courage, young people. I truly, truly would. But so to the Office of Mental Health and the New York State Psychiatric Institute, I thank all of you for making us feel welcome here today and talk about how we talk about teaching and integrate research and therapeutic approaches for care for patients with mental illnesses. And I thank you from the bottom of my heart for what you're doing is trying to figure out the human condition under circumstances that no other generation had to deal with. And it's hard, but we'll be looking to your guidance, your advice, your research, your solutions. As a leader of this state, we want solutions. We don't want to pretend we have all the answers. Never a good strategy. We ask the experts. And so I thank you for helping lead the way, because New York is always a leader no matter what we do, and this is another example of that. So we're here to talk about how we can get people the care they need. And one of the conversations we have with the young people is it's really hard to ask for help. It's really hard. There's a stigma associated with it. It shows a vulnerability, a weakness. We're told to be strong and tough. Do you really need help? Guess what, everybody? We all need help at different points in our lives. So overcoming that stigma is an important part of letting people know they don't have to go through what they're going through alone. And I thank the young people for reminding us of the responsibility we have as adults to make sure that those support systems are in place, particularly in places like schools, where young people spend most of their day, or after school programs. We talked about how important that was to have positive activities outside the classroom before they go home, and the temptations of the street may be there on the way home. So we talk about mental health. It's been overlooked for a long time. This is not a new phenomenon. No one ever talked about mental health. It's kind of shushed about. You know, someone who needed help or a therapist, like, oh, you don't want to tell anybody about it. There's a shame associated with it. But right now, our nation and our state are in the middle of a mental health crisis. And it's impacting all New Yorkers, and that's why in my budget and my State of the State address, we put mental health front and center. Never before has a state leaned this hard, this publicly, into the issue of helping people deal with mental health challenges. So I've said the era of ignoring mental health is over, declared it so, and we're going to lean hard into this. So how do you do that? How do you do that? Well, first of all, we look at the entire continuum of care. There's not one place and one therapy, one solution. It's the whole continuum of what we offer people who are at different stages in their experience in dealing with mental health issues. And it's a monumental shift in thinking to say that it's more than just providing a bed at a hospital and we're done with you. Good luck when you leave. That doesn't solve the problem. So I was so proud to announce, as a statement of my priorities and the priorities of this state, $1 billion in our budget to improve access to mental health care. And no one has really paid much attention to the delivery of mental health services since the 70s. You know, those who are really old, and I don't see many really old people in this room. But the deinstitutionalization that occurred in the 70s when the government policy was bad things are happening inside these hospitals, inside these buildings, so the answer is open the doors and let everybody out, and good luck. That's when we started seeing people on our streets in the throes of mental illness and crises without supports. Now, that does not mean what they're getting inside those institutions was appropriate or in the best circumstances. We know that. But the alternative of just benign neglect and saying you're on your own was an epic failure as well. When I was a teenager, my parents were very much involved in the social causes of the day, every single issue they cared deeply about, and instilled that in me. One of them was that the West Seneca Developmental Center in my nearby community was on the verge of releasing all these people who had literally grown up there. They knew no other life, and yet they're supposed to be able to go to shopping and find an apartment and take care of themselves. And so we brought young people, and I was probably 13 or 14 at the time, we brought teenagers into our home, and my job was someone who knew how to get to the store and go to the drugstore and go grocery shopping, go to a movie on my own. We took these people, and their names were Melanie and Roger. I still consider them siblings because we spent so much time with them. Our job was to help them integrate into society, but that was one family and two people we could help. So many people didn't get that. And so we're investing in, yes, bringing more psychiatric beds online because during the pandemic, so many of those beds were needed for COVID, understand that, but they weren't brought back online when we stopped needing the beds. And we asked hospitals to do this last year. Please open up the beds. We even compressed the reimbursement rates for psychiatric beds because they didn't meet what you could get with a non-psychiatric bed. We learned that, so saying, why is this happening? So we try to do that. This year we're being a little more aggressive about it, saying we plan to have this change. So we'll bring more psychiatric beds online. That's for people in a serious condition, many people who've been on the streets. You take them off the streets or you encourage them to come off the streets. We have all these teams in the subways and elsewhere working with the mayor, finding people, persuading them to trust someone enough to go with them to get help. But you show up at the door and there's not a place for them to go, what have you achieved? So we need more beds online. But also, we have to fund supportive and transitional housing for them as well. So we're going to build 3,500 supportive housing units to make sure that people who are, again, the continuum of care, you might need the hospital in the short term. Now you have a plan. You need to stay in touch with a provider, but a place to go, a place that has supportive services wrapped around you literally like a blanket to make sure that you can get through what you're going through. So we're building more residential units with wraparound services, expanding our outpatient services, and also ensuring that insurance companies, and this has been a barrier for too many people, insurance companies pick up the cost of mental health care. They should, and they need to start doing it now. But in addition to all this, today we're here to talk about a special focus on our young people. First, we need to find ways to increase mental health services for our young people in the first place. Too many schools have barely guidance counselors. We were talking to some of the students about the number of therapists they have in their school. One student would say, I have 700 students. We have 4 adults to handle this, or one person for 300. I mean, every student that we spoke to a short time ago had a number, and they knew that they saw the long lines of their friends who are sitting there. And imagine, you talk about stigma, it's awkward. It's hard enough being a teenager when you finally decide you need the help, and then you're supposed to go wait and wait and wait and wait for someone to finally give you attention. And these individuals are doing God's work on earth, these therapists, these teachers, these guidance counselors, mental health professionals in schools, but there's not enough of them. And they're asked to do the impossible. We have to give them more support. We need more services in our schools, full stop. And that's how we start dealing with young people before they get to a point where they need a lifetime of care. You help them when they're starting out in life, and you can get rid of it and help them have coping mechanisms. So when stress comes their way, and it always will, that they know how to deal with it, because a professional, an adult, could help them in that time. We also talked about, in our group, about the need for more peer counselors, right? Young people are all shaking your heads, right? This is what we need, is training for our young people. We should talk about who you're going to trust when you're 13, 14, 15, 16 years old. Sometimes you're in collision course with your parents. I know. Believe it or not, I was once a teenager. And I actually raised a teenager, a couple of teenagers, especially a teenage daughter. We both survived the experience. But I saw what she was going through, and it was hard. It was hard. And because I was in my career, I knew what to look for. But parents, they don't know the signs always. Teachers have so much on their minds. I mean, who are the people who are going to say, yeah, this person needs help? It's often your friends. Imagine if we could give some training to other classmates. They don't have to have this as their career, but just during that time, some of the toughest time in life when you're a teenager, to have more people who'll be kind of watching out for this, paying attention to signs, because students need these services now. And we're investing over $30 million to expand school-based services across the state, and that's just the start. And we're going to have $10 million for suicide prevention, because the suicide rates are staggering. And to know that 1 out of 3 teenage girls have contemplated suicide, and actually boys, young men, they actually accomplish the suicide at a higher rate. We're losing our kids. And the effect on their friends and their family, it never goes away. It never goes away. So we're investing in all kinds of services. Eating disorders, so common, who talks about that, just kind of a shame associated with it. We're investing money there. We're investing $12 million in a Healthy Steps program promoting early childhood development, as well as at-home crisis intervention for children and teens. And what we're going to be able to do, if we get the support from the legislature, it's in my budget. We're wrapping up the budget hopefully in the next few weeks, just getting started, but there is an end we hope to achieve. If we get that $1 billion, we'll have the resources we need to do what we have to do and continue to meet the unmet mental health needs. So focusing on our young people is the most critical thing right now as far as I'm concerned with mental health, because they're the most vulnerable. We just talked about the gathering I had. And we're the adults, right? It's up to us. It's up to us to figure it out. And when I think about the fact that 37% of high school students are reporting poor mental health right now, and that has many layers. What is poor mental health? But the fact that that many are actually saying, and think about the ones who would never even say they do. It's probably everybody else, right? It's a normal state of affairs, but it can escalate. It can get worse if there's not treatment and help. So we also know that more black students have attempted suicide. And when it comes to LGBTQ plus teens, more than half have already experienced and report having poor mental health, and more likely, 4 times more likely to have attempted suicide. Imagine the stress on these young people. So, I'm a mom, as I've mentioned. This affects me personally. First mom to be the governor of the state of New York. First grandma to be the governor of the state of New York, but that's another story. But it gives you this emotional intelligence that I can bring to this, and the passion that I bring to this crisis, because I know the kind of world I want to live in, and it's one where we're here to help our young people, all of our people, give them the support they need, and realize that there's influences out there. Media, I never had to deal with this, never had to deal with this. Now, we talk to the young people. Most of them, their preferred platform is Instagram. I'm not sure that's always showing positive images of young people, making them feel good about themselves, how they look, and about their lives as having positive forces. But we also talked about how there are places where they can get positive messages. And we have to kind of switch the whole conversation. If it's going to be there, how we can have companies realize their responsibility as well to give out messaging and content and get other people to put public service type ads out there that can make you just feel better about life. That's so doable. That is absolutely something we can do. So we have to talk to also parents. Parents, do you know what your kids are seeing? Do you know who they're talking to? 12, 13, 14-year-olds do not know who they're talking to. I tell you, it is so easy to disguise yourself as a fellow teenager and lure someone to sites or to a physical location. That is becoming way too common. So parents need to know that as well as our peer counselors. So I'm here to announce that today was the very first of a series of listening sessions. I'm going to get out there. Let me just put the budget to bed first. As soon as we get that done, I want to tour the state. And I want to help break down the barriers and the stigma and let more people talk about it. And then there's a ripple effect. There's a ripple effect. We can change. I have no doubt in my mind we can change people's attitudes by just leaning into this and embracing it and knowing the power of our voices and being trusted advisors of so many other people. So we're going to do that. But also this spring, I want to have a summit and bring together the experts, the law enforcement who can help remind us the dangers that lurk out there, have professionals in mental health, the signs to look for. I want to bring in the social media platforms leaders, people in this space who we can convey to them their responsibility to help change the whole dynamic and what their influence is all about, make it more positive, and bring together young people and clinicians, experts. I'm going to bring everybody together. Anybody who wants to help solve this, you're coming to my summit. Okay? So we're going to do this. And let's just look at it from a common sense approach. What are the tools that we need? How we can help people? And I will tell you right now, before we get to this, I don't have all the answers. But the answers lie out there. And we started today with those conversations with our young people, getting me thinking about things differently, getting the adults think about things from the perspective of the young people, the people we're trying to help. So then we'll talk about how we have policies that support the ideas, whether it's prevention, whether it's treatment, and other interventions that we can work on with legislation if necessary. So let's confront this with urgency. I'm urgent. I have a sense of urgency around this. I hope we all do. Because one more young person who thinks that everything is so hopeless, they decide to take their own life, that's not a tragedy for that individual and their family. It's a tragedy for society. It's an indictment on all of us that we weren't there to help somebody in need. That's not okay. This is New York. We're always better than that. And I know that listening to the young people will make a difference. And that is why I'm very proud to introduce our representative of the students, a student leader, Kay Danielle Thompson, a 17-year-old student at Hillcrest High School from Queens. We talked about Queens as being the most diverse place on the planet. It's fascinating. And she's a member of a group called Youth Power that makes sure that young people have the support they need and live in a community with respect and dignity. And I want to thank her for her leadership in stepping forward and being an advocate for other teenagers across this country. So, ladies and gentlemen, let me present to you Kay Danielle Thompson.
Good afternoon, everybody. How are you guys doing? Good? So as mentioned before, my name is Kay Danielle Thompson, and I am 17 years old, and I currently attend Hillcrest High School in Queens as a senior. I would like to thank my guidance counselor, Ms. Vega, for taking her time to interact with the students and make our high school year a lot better. Like it was said before, adults, they really play a role in our lives, not just our peers, but adults as well, so it's good to have that kind of comfort with us. For me, Ms. Alana Vega, She made our high school life a whole lot better, and I feel like there should be more school staff and more adults who do stuff like this. I would also like to thank Queens Community House, Families Together, NYS Youth Power, and Governor Hochul for providing this opportunity to listen to the youth about the issues that affect us directly. There are many things that affect youth daily when it comes to mental health, and some of those things are the pressure of school, finances, even though we don't pay any bills, self-esteem, education, and just knowing how to deal with stress factors. We're not really taught how to manage our stress or how we can do it in a healthy manner. Over the past couple of years, some of the top things that the youth has struggled with is isolation, which is how we try to cope with whatever stress we're feeling, drug abuse, unfortunately, and managing our emotions in a healthy manner. Sometimes we are not comfortable with talking to staff or peers, and we have a hard time connecting in general. One way that I am managing some of my stress is by speaking with my guidance counselor. I feel connected to Ms. Vega because whenever she can, she makes time to not only converse with me about academics, but about my personal life as well. I feel connected to Ms. Vega because she's very mindful and she lets me guide the conversation. When I'm talking, she listens and she tries to help. It's not like I'm talking and she's like, okay, I have to follow this protocol. She's actually listening to me and taking into consideration how I should be helped personally because every student is different. Miss Alana Vega gives me pointers on stress management and how not to be upset. She gives great advice, keeps the information confidential, and she goes above and beyond, not just for me, but for all the students. Meanwhile, my sister, who is the same age as me, and she goes to a different school, does not have a guidance counselor as caring as mine. Because of this, she has held a lot of things inside, which had a negative impact on her high school life. Having staff, not just guidance counselors, who know how to support young people are very important. Staff like mental health providers, school psychologists, teachers, caseworkers, social aides, school safety, and much more need to be trained on how to engage youth to succeed whether they struggle or not. If you help them while they are not struggling, you can prevent them from struggling. So there are a couple of programs within schools, but they're not directed to helping the youth. But there is this one program that I am a part of, and it's called Council for Unity. And programs like Council for Unity I find to be very helpful because it helps me be creative instead of idle. Idle is usually not healthy for me or anyone else or any other youth. We also do things in the community like PS I Love You Day to show support for youth and even adults struggling with suicide. We also did a hygiene drive for youth who do not have feminine products and families who do not have daily hygiene products like soap or toothpaste. Youth need to be encouraged to participate and get involved when it comes to giving back to the community. These things help the youth focus on positivity and filter out the negativity. We should give back because we want to, not because we have to. We have a lot of pressure with community service, and there are some high schools that say you can't graduate if you don't give back to the community, or if you don't have a certain amount of hours giving back to the community, you fall behind. But I feel like forcing us wouldn't really encourage us to work, and I feel like it helps us better when it comes from our heart. Yes, it'll help the community if you force us, but it will help us as well if it comes from our heart, and if you provide us with an opportunity that we would actually like. You know, because not everybody, thank you. Not everybody wants to clean up at a park after school. You know, like like there are some people who actually like helping old people, and that counts as community service. Yeah. Yeah, even helping old people would count as community service. And there are some students who would want to do that as a career. So instead of forcing them to clean up somewhere, they can help older people, and it would come from their heart because they would want to do that. Schools being overcrowded is also another thing that has a negative effect on us because there are too many youth to a classroom and too many students to guidance counselors. So that kind of prevents youth from getting individualized attention and support that they need. If they have a guidance counselor or if they have more guidance counselors to help the students, then the students will get that support and it could prevent these mental health challenges. Also, it would limit the number of caring adults that students have access to. So once you have more guidance counselors, then this could be prevented. There will be more guidance counselors to help a student or even the whole class. As a youth who had her own struggles and has supported peers through challenges, these supports have inspired me to have a long-term goal of having a place where homeless people can get both housing, education, and resources. I feel like a program like this should be implemented because, like Governor Hochul said, there are people who need better housing, and although there are programs put in place for housing, it shouldn't just be a place you go because you need somewhere to live. It should be a place you go where you can live and you can learn, and then you can use what you learn to help yourself when you get out of that place. I want to say that I hope Governor Hochul and other elected officials continue to invest and support children's mental health genuinely, and not just because people are talking about it, because you actually, you actually want to and you actually care. Because the youth are not only the future, but we are the right now. We're kind of pushing you guys out the way. And we're here. So I want to thank you guys again. I can't wait to see what Governor Hochul does next. And I'm now passing the mic to Dr. Michael Lindsley.
So amazing. Wow. Good afternoon, everyone. Thank you, Kay Danielle, for the courage to share your story with all of us and for your strength in moving this conversation forward. Thank you so much. Thank you, Governor Hochul and Commissioner Sullivan, for giving me the opportunity to be with you today for such an important conversation, one that is incredibly meaningful to me, as you will hear. I also want to acknowledge my colleague and friend at the NYU Silver School of Social Work, Dr. Michelle Munson, who is here with us today. Like me, Dr. Munson has spent her life's work researching mental health services and interventions for adolescents. Thank you for all the great work you do. I cannot overstate the importance of the topic we're here to discuss. I'm so grateful that our governor recognizes the gravity of the situation and is hearing our young people's cry for help. Like the governor, I want to underscore the urgency of providing our youth with the attention and the resources they need to cope, and more importantly, to live their best lives, especially after everything our society has been through over the past few years. We must ensure that our young people can truly thrive, not just survive, but thrive, not only in terms of their physical health and education, but also their mental health. What you're about to hear involves some uncomfortable truths about how our teens are feeling, but it is a conversation we must have in order to save our children. So let's start with the numbers. Today, about 145,000 young New Yorkers between the ages of 12 and 17 have depression. Yet more than half of them did not receive any mental health care within the last year. More than half of them. Untreated mental illness can have long-lasting effects on a teenager's life. For instance, we know that high school students with depression are more than 2 times as likely to drop out of school than their peers. Sadly, some of our children are hurting, so much so that they are contemplating ending their lives, and occasionally they follow through with it. Indeed, suicide ranks as the 3rd leading cause of death for young people in the U.S. aged 10 to 24. Let that sink in. So many of our children see no other option than to engage in self-harming behaviors, and this is sad. When we look at Black, LGBTQ+, and female students, the rates are worse. My research at NYU shows that the rate of suicide attempts by Black teenagers increased by 73% between the years 1991 and 2017. It is why together, Commissioner Sullivan and I created the New York State Black Youth Suicide Prevention Work Group. Together, we are determined to hear our young people and provide them with the help they deserve. Those are the numbers. Now let's talk about the lives lost. I've spent my academic career researching depression and suicide trends in teenagers. Along the way, I've met too many families who were devastated when they lost a child to suicide and wondered whether they had missed the signs. Rylan was 11 years old when he died by suicide in Washington, D.C. in November 2017. I interviewed his mother for a book I've been working on to identify factors related to why Black youth were seeing an increase in completed suicides. His mother told me she had gone to the store and was running errands, and she told her son that I would return home in a few hours. She called Rylan on his cell phone while she was out and said, "When I return home, can you help me bring the groceries into the house?" He said, "Okay." His mom came home and knocked at the door. She called out, "Rylan, come help me with these bags. I told you that I was going to need some help." Rylan didn't respond. So she set the groceries down, went to his room, and there she found him. She struggled to find the answers in the aftermath of Rylan's death. Like so many parents that I've spoken to, she didn't see any signs of trouble. She asked me, "Please share this story with the world if it can help other families, but also help me to understand why my son died." We may never know why Rylan died by suicide, but what we do know is that each of us has an opportunity to save a life, and education is key. When young people withdraw, when they start acting differently, parents, coaches, teachers, mentors, thank God for Miss Vega, all of us that engage in our youth lives can have a role in helping them. Sometimes all we need to do is hear them. I've dedicated my career to ringing the alarm and establishing evidence-based solutions in these difficult situations. Initially, I focused on trends I was seeing in boys, particularly Black boys. But increasingly, I've been troubled by rising rates of suicide and poor mental health among teenage girls. We are still learning the reasons for these heartbreaking trends. But what we do know is that connecting our young people to mental health care and supportive services will change the trajectory of their lives. Simply put, providing our youth resources will save their lives. That is why Governor Hochul's commitment to expanding community mental health services for children and teens is vitally, vitally important. So is her focus on expanding mental health services in schools and her commitment to suicide prevention programs targeting at-risk youth. Public schools are the main provider of behavioral health services in the U.S. The best way to connect our youth to treatment and care is to provide services in the places they learn and live. In fact, young people are 21 times more likely to seek care when mental health services are accessible to them in schools. As Dean of the NYU Silver School of Social Work, I know what a difference it makes when young people have access to trained mental health professionals who frequently are social workers. Yet too many schools in our state and in our nation are under-resourced with respect to mental health services. That's why the steps that the governor proposes are so important. We can't wait for the signs that our teenagers are in distress or not see the signs and risk more tragedies like the one that befell young Rylan and his grieving mother. Let's begin turning around these trends. Let's invest in the future of our state through its most precious resource, our young people. Thank you, and thank you for joining us today.